All right, everyone. Welcome to another episode. We are so excited to have you today. Welcome to today's Digital Health News episode. I am Seppi Browning, and I'm thrilled to be joined by a colleague and a friend, Mr. Nick Yatsky, a recognized leader in artificial intelligence and healthcare innovation. Nick has been at the forefront of integrating AI into care delivery, driving smarter decisions, improving outcomes, and shaping the future of patient centered technology. In this conversation, we're going to explore where AI is making the biggest impact in healthcare today, how to balance innovation, trust, ethics, and what leaders should be doing right now to prepare their organizations for the future. Whether you're a healthcare professional, technology leader, or simply curious about AI and how it's reshaping the way we experience care, this discussion is for you. So let's dive in. Nick, welcome. Thank you for joining us today. If you don't mind, introduce yourself.
First of all, Seppi, thank you so much for having me on this. I'm so excited to be here to chat with you, to talk with you about some of the some of the innovations, some of the concepts and ideas that really are coming up in the healthcare and AI overlaps, so to say. Both of these areas are evolving so rapidly in so many different ways, and these days they are obviously crossing over, and they're obviously impacting each other quite heavily. To give you a little bit of background about myself, I am not a doctor. I am not a nurse. So I'm not going to be answering any medical questions for you. You will not appreciate those answers, anyways. I am an engineer by training. My background is, for the most part, within the artificial intelligence realm. I like to say I was doing AI before it was cool. Before GPT became the household name that everyone knows and what Gen AI is. But well before that, I think we all recognize that the concepts of AI have been around for many decades. It's not a new thing that it just simply poof appeared out of nowhere, right? And so my background has been in the digital space and the automation space. I've been working in the health and wellness space for well over 15 years. Most recently, I was the chief AI officer at Wellstar Health System. I was leading the AI implementations. I was leading digital transformations, enterprise architecture concepts. Before that, I was in charge of much of the application engineering and product development within ShareCare. It was a startup at the time in the digital health and wellness space, really driving a lot of that consumer-focused innovation, um, digital therapeutics of various sorts, ways of really engaging the patient on living a healthier life.
And trying to live the best of it, right? With
That's
everything
right.
going on with challenges, and we're hoping that all these technology and tools can actually bring some value to our patients and to our caregivers. So let's start with our first perspective here. So the real world value. Um, Many of the organizations they're experimenting with AI in healthcare and trying to identify their priorities and where they're going to get their biggest bang for the buck. Um, from your perspective, where are you seeing AI being applied in healthcare and bringing a good level of ROI, which we're all trying to, in some level, identify, measure, capture, etc.
Absolutely. I think the reality is that health systems are experimenting with AI in all aspects of the system. It's not just one area, it's not just clinical or just administrative, it is across the board everywhere. Where are they having success? That's a more difficult question. That's a tougher question. But if we think about the main focal areas of applying AI for the betterment of the patient, you have direct patient engagement itself, where you are actively interacting with a given patient, whether the patient is outreaching or we're outreaching the patient, whatever it might be. It's direct access between an AI agent and the patient. There are capabilities of AI that are being deployed across hospitals, across clinics, across doctors' offices, the individual inpatient rooms and ambulatory rooms. Things that are being used to assist telesitting and virtual monitoring, a lot of those virtual nursing kind of operations. There's a lot of work being done to help augment the actual clinician at the point of surgery, at the point of a patient's visit. There are tools that are being implemented to do research to help physicians understand what is available or what potential new solutions might be, or helping understand what those symptoms really add up to be able to diagnose better. We're seeing AI being used more traditionally from more of a data analysis standpoint, right? The the quintessential concept of machine learning from a statistics standpoint, being able to take a large amount of data and really analyze that data to understand where are the trends, where are the projections, what are we going to need, how many patient beds should I expect to have available during surge, things of that nature. We are seeing a lot of business automation processes, typically things that had been done far more deterministically in the past, things that were more prescriptive of click this button, take this data, put it over here, do this, do that, do this, do this, get to the end goal. But a lot of those steps tend to change. And so the cost of maintaining these processes tends to rise pretty quickly. And with the AI capabilities that we're seeing in Gen AI, those things are becoming more flexible. They're People are building agents that are almost self-healing. They're able to detect changes or variability in some of these areas and be able to augment these processes to be far more flexible, far more able to adapt and change over time. And then we're also seeing a lot of work within workforce noise reduction. So the way that you as a administrator or you as a clinician are interacting with the patient, interacting with the system, and the cruft work that everyone has on their docket. I think everyone has some amount of that within their respective day-to-day jobs, and trying to reduce that, trying to reduce the amount of that cruft that you have to execute on a day-to-day basis for the purpose of being a lot more productive, being able to
Yeah.
do a lot more with the time you have. The idea of reducing pajama time for our clinicians and really reducing some of those steps and hops they have to jump through. Now, the question you asked is a follow up around the ROI, and that's a more difficult one. That's a much more difficult one. When we talk about specific ROI of AI specific solutions, the reality is that we're probably too early in the process to really be able to say there's a clear cut ROI. It's a lot more in the space of just simply being able to do more with the time you already have, as opposed to saving hours and increasing throughput and things of that nature. Right now, we're still experimenting at the stage where we don't fully trust the AI processes yet. And I say that very clearly, yet,
Hmm.
because these things are changing and evolving constantly. And so it's very hard to quantify with a dollar figure the ROI. But we are seeing quantified ROI from a satisfaction standpoint, from a reduction of overhead, a reduction of overload on the individuals. Those are really the things that we're mostly looking at within the healthcare space around the impact of AI on our day to day.
Yeah. And one of the use cases that I've really come to appreciate is the virtual nursing, where we've had some new nurses at the bedside, and those individuals and those more seasoned nurses, just a call away, a virtual call away, has really helped with that level of support, and that nurse, the newer nurse, knowing that they are there for them. And yes, sometimes it's used for just discharges and some of that, but it's also there as a support system too, as
Certainly.
the nurses with the boots on the ground get more familiar with the tools and get comfortable with the teams that's across that camera, and everyone becomes more fluid. There's a lot of different value adds. Like you said, it's so hard to completely measure right now, but everyone's in their different state of mind with this tool and technology and how it kind of integrates with their workflow. So, speaking of trust, kind of moving on with a different perspective on all this ethics. right? Ethics and trust.
Mhm.
So, how have you seen the patients and clinicians uh, in their response to the use of this AI in these different use cases? And what's been some of the driving or deterring points that impacted adoption?
Absolutely. So if you were to ask me that question about 4 or 5 years ago,
Hmm.
the general sentiment that I was receiving, and this is just my perception of this, of course, I don't have, a formal study on this, but from what I've seen, there was a lot of trepidation around, why are you approaching me with AI? I'm a physician, that I know what I'm doing. I know how to do this work. This is what I signed up for. Why are you bringing this AI to me? But in the past year, it's really flipped it on its head. It's really been an entire 180 change here of a lot more clinicians are going, you know, let's talk about this. Let's figure out how we can use this to really improve things. I think the reality here is the trust starts to build with more use, with more acceptance, and when it becomes ubiquitous in our day-to-day lives. And I think that even outside of healthcare, especially when you look outside of healthcare, we as consumers, we as individuals, as humans, we all have cell phones, right? We all use these things. These things are now starting to use AI, and have continued to use AI, I should say, in so many different ways, and we're getting so much more used to it. And so we as patients are definitely getting more used to it,
Yeah.
right?
Wasn't this the same conversation when EMR use and meaningful use started? It was the same level of conversation of why and the trust
Absolutely,
in the
absolutely.
products. Yeah.
And so I think that you also just hit a nail on the head real quick, that when the EMRs were first starting to really become used, or moving from paper to digital within that space,
Hmm.
what was the promise of the EMR? It was to produce better outcomes, to have a lot more streamlined access to data, to have a lot more simplicity and straightforward kind of
Hmm.
interaction with these
Right.
things.
Right.
Some of these things didn't quite pan out like that, right? Some of them introduced a lot more overhead of, well, I have a lot more documentation to do. I have a lot more work to do. I have a lot more of this and that. And when some of the first AI tools started to really hit the market, they also had that same kind of promise and problem of, yes, it's an AI tool and the promise is huge, but I have to do this and this and go to these other areas to use these things, right? And these days, as these AI agents and the AI capabilities are becoming a lot more integrated, a lot more seamless, a lot of those friction points are starting to ebb. They're starting to go away, to where it's much more accessible, much more streamlined, much more integrated into your EMR, into your day-to-day. You don't have to go and hunt and peck for these things. They're already available to you, right in front of you.
Absolutely. And you touched on this a little bit already, the whole balance of the promise
Mhm.
of these tools. Um, but let's discuss a little bit more with the patient privacy, some of the biases in these potential models and how they're potentially deployed,
Mhm.
and the need for transparency about what we do know, and some things that might be under the cover and it's not always as evident.
Yeah.
What's your perspective there?
Yeah, I think it's a quite a large topic of discussion, right?
Yeah.
The reality here is this. The way I think of it, at least, is this: we are human, and humans by their nature are biased in one way, shape, or form. Whether it's inherent bias, or if it's just experiential bias or environmental bias, whatever it might be, there's always going to be some level of bias. It is absolutely going to be there no matter what. You can try to fight it, but ultimately there will be some amount of it that permeates, and it will impact your workflows. It will impact your actions. It will impact what you're doing. And part of that is your human bias is also represented in the data that you collect on patients, in the information you put into the systems, the data that then feeds those agents. So there's, I think, a couple of tiers to the bias that we need to think about here.
Hmm.
One of those tiers is the bias that the agent itself is applying on the data itself. But the data itself is also going to be biased to a certain degree. And so now you're kind of fighting both ends of it. Um, and so it becomes very tricky. It becomes very difficult because there's no real measurement of bias, right? You can't say, well, this has 10% bias. That's not a thing.
Right.
It's very subjective by its nature. And so we're always, when we are implementing new AI solutions, we're always trying to mitigate bias. We're trying to understand the bias that could potentially be in these systems. And the way we mostly do that is by understanding where was the data trained, where did the data come from, how the agents were trained on that data, how do we make sure to account for the right kind of populations. To give you an example, there was one vendor I was working with that was using computer vision, and they were doing some things on facial recognition. They were looking at faces of individuals. That information is very dependent on the physical characteristics of an individual, right? It's not about how they think; it's about how they look. That's just how the facial recognition works. But their models were all trained in Southern California, and we're trying to implement them in Georgia. Populations
Yeah.
are not exactly the
Yeah.
same. Demographics are not
Yeah.
the same between
Yeah.
Southern California and Georgia. And
Right.
so you have to account for that and understand that, and you have to test. And so
Right.
that's really the ultimate end result is that you train the model somewhere, whatever it might
Sure.
be. You understand where you got trained. You then
It's
start
a
testing it.
baseline.
That's right. You take your baseline, your foundation, you test it on your target population, a
Hmm.
sample set of it, of course,
Hmm.
and then you start to fine tune, and then you start to
Yeah.
tweak, and then you start to adjust to account for any variability within those data sets.
Sure. And it's so hard for human nature, but with this, just like a lot of things we all do, time is what is needed
Hmm.
for improvement, for learning, for adoption, for, like you said, for you to continue to train it and improve it. And it's not part of human nature for us to be patient and wait for some of that. Now, so clinicians, we continue to offer them solutions and tools, and while they're still at the bedside, very busy taking care of patients and doing what they were trained and intended to do. Um, they are often facing technology fatigue,
Hmm.
again, on top of everything that they're doing. Um, and we have hopes that these tools would eventually bring value. So, how can, in your perspective, AI tools be designed to support their workflow, maybe at a more, I don't know if the word is quicker, or in a more beneficial deployment
Hmm.
or integration into their workflow, so that it will bring less burden to them. What are some of the means that you've seen that happen?
So I think the key words that you just said were support their workflow.
Mhm.
It's not create a new workflow for them. It's
Mhm.
support their existing and the things that they're most comfortable with, the things that they already know how to do and they are most effective at doing, and making those workflows just that much more accessible and that much easier. I think that's the fundamental key here. It's integrating these AI solutions in a way that you're not sending the clinician somewhere else to do something else, right? If you come to the EMR that the clinician is using and they have to click a button that takes them to another website where they have to log in and do something else and copy this over there, that's a non-starter. That too much, right? You want these things to be right there in front of them, right within their direct use case, so they don't have to go and do a bunch of other things.
Right.
I think the biggest direct impact that I keep seeing time and time again is the ambient scribe model.
Yeah.
And I think that just about every health system these days is starting to implement some level of AI scribe. There's several vendors that are major players, many that are smaller players, of course. But the most common one and the common flow is a physician walks in, pushes a button on their phone, put the phone down, and the phone is recording the conversation.
Right.
There's no special microphones, there are no special headsets, there's no special additional equipment. They already have a cell phone and is simply using that cell phone in their point of care with the patient. They're
Right.
actively having a conversation with the patient, and that phone is recording that conversation and acting on that conversation. Now, if the physician had to take that phone and upload the video stream or the audio stream somewhere and do some other stuff with it and then something else, it also wouldn't help. But because they can take that recording, immediately transcribe it, summarize it, document it, and present it them on their computer, on their laptop or their desktop in the
Right.
actual clinic at the point of care, and give them that summary, that right there is integration. That's what really is enabling a lot of that uptick, that use of these tools.
Absolutely, giving that one-on-one time, and so you're kind of leading us to what the future should be, right? So again, in Nick's crystal ball, how would you expect the next phase of AI to look like in a healthcare setting? Like where do you see us going next?
So I think there's several different avenues that are really at play here. One is one of the things that I mentioned around direct patient engagement.
Hmm.
And so it used to be that patients would go and play Dr. Google, right? You
Hmm.
would Google your
Used to,
symptoms and you would try to figure out what do you have. And
yeah.
oh, by the way, you might have Ebola. Yeah, no, you don't have Ebola. I know you don't have Ebola. It's okay. But, these kind of more generic things were giving you a lot of false positives that were just nonsensical. AI has become so much more effective at really diagnosing that really I think we're starting to see a lot more of patients should be able to pre-diagnose or pre-triage, right? Get a good understanding of here's what I think I'm feeling, here's how I can actually understand this, and use some of this automation, some of this AI to really help paint a better picture of what is actually going on with the patient, a much deeper picture,
Yeah,
and
you
have
know what?
that. Go ahead.
One of the things that I've seen is patients are able to come better prepared to
That's right.
articulate their symptoms so that they can actually provide the right information also to their providers. That is another positive flip side to this education as well.
That's exactly right. Just preparation for the visit, preparation for a procedure,
Mhm.
preparation for the conversation, I think is getting a whole lot better and is going to continue to improve drastically. Now, you factor that in with the digital tools that we're already using to communicate with providers and getting that information earlier to the providers, having the providers be able to automatically use a lot of these tools to give them a better insight into the patient itself.
Right.
So if the patient did scans, did radiology imaging for various things, and having radiology AI models that are able to provide the physician's guidance on, hey, there's this, this, and this. Here's what we're seeing. Here's what we have here. Eliminating a lot of those manual processes and providing the plethora of information in a digestible way, and really expanding that to where at the moment you walk into the office with the physician and you're sitting down, the physician already has the insight of what you've been experiencing because you've worked through that. The physician also has done extensive research without lifting a finger because it's already run it through a lot of the AI models to get them a lot of that information of here's what this might be, here's what we should be talking about. But I think the thing that we're still missing there is that modality of how we inform the clinician of what the possibilities really are. Because one of the things that I keep seeing time again is when an AI model spits out, hey, here is the singular one next action item for you.
Hmm.
And when it's a singular action, it's very hard to simply say binary, yes or no, I'm
Yeah.
going to do this or not going to do this. But if those models on screen within the EMR, within the patient's chart, are giving the clinician information on here are the top 5 most likely things, and here's the probability that these are the right things that we're looking at. You're starting to, by doing that, by giving those probabilities, you
Hmm.
help reduce hallucinations because
Right.
then you can tell, well, this is a 2% chance of it being true, so probably not going to go with it. As opposed to this is, 85% true, whatever it might be. You're giving a lot more trust. You're
Right.
able to encourage the physicians to trust what those recommendations are and be able to build the trust with the patient too.
And you're
You're
training the
talking
model more adequately too.
Absolutely. But when you're giving the patient options, when you're giving the physician options, and
Mhm.
you're not prescribing directly what the
Mhm.
AI is doing, but you're opening up the door and saying, here are the things that are available to you. We as humans want to have control over these things, right?
Yeah.
And so we want to have these options and we want to be in control of the next actions. And so I think that the future of, or really the next phase, I'm not saying 10, 20 years out, I'm saying 1, 2, 3 years out,
Yeah.
we're talking about having a lot of that kind of granularity and information and able to make our own decisions and be able to then identify lookalike data, be able to identify based on my experience, my history, my biological markers, my demographics, everything of sort. Here are the next things that will likely happen. Or if I go this route, here are the things that will likely happen. If I go this route, here's
Right.
what will likely happen. And be able to project these things.
So to get there, the leaders and our healthcare executives, there are our HIT leaders, our CIOs. What advice would you give them to help prepare their organizations to get there to what you just shared? What advice would you give?
Number one thing I would say is don't be afraid.
Mm,
Keep calm and carry on, right? Don't be afraid of the evolution that is happening within the AI space. First and foremost, AI is not alive. It is not sentient. It is not Skynet. Not yet, but it's not Skynet. It's
not helping.
these things are evolving so rapidly
Right.
that simply sitting on your hands and not using them or not adopting or not trying something is
Right.
not an option, not anymore. It was a few years back, it's not an option anymore. And the idea here is this: you don't have to wholeheartedly commit 100% to a solution and go full throttle with it. But there are so many options, so many ideas. Try them, take them off the shelf, play around with them, get the buy-in, get the workflows defined, and give them a shot. Try them out. Don't plan for a year or two and then maybe do something with it.
Right.
Take it, try it, and use it as quickly as possible. You want the cycle to be ex- just, I don't know, even know how to say it. It's uh, the fastest possible cycle you could possibly think of. We used to think of software development life cycle and applications as, this cycle that iterates 2 week sprints with agile and
It's a
stuff
little
like that.
opposite of it.
You want to go even faster. You
Yeah.
want to go even faster than that. You want to
Yeah.
simply take a solution, try it out. If it fails, it fails. Move on. That's fine. There's so many of these solutions that you can recycle them. You can go ahead and throw them away if they don't work out. But it's not an option to simply take it and sit on it for a year and then maybe try it.
Because it would have changed by the time you want to actually deploy what you
That's
had
right.
planned to utilize. Yeah.
That's right. You're not marrying these individual solutions. You are simply trying them, working with them, giving them a shot. There will be so much change and evolution in these solutions from the time that you start to the time that you actually go full scale with a solution, that you have to be able to adapt. You have
Yeah.
to be able to continue to iterate and innovate on these things.
And IT, we always say change is inevitable, and
Mhm.
you need to be able to pivot, and you got to be flexible. But this is the exact case of what is needed or called upon
That's
for
right.
all of us, right?
That's right.
Um, Well, Nick, thank you so much for your time. I'm so glad you were able to join us, and I always love hearing you. I've heard you speak a couple times, and um, you're always very engaging, and you always very much impress me with your knowledge, your background. We really appreciate you joining us with our episode today at Digital Health News. But before we end, I would like to close and give the mic back to you and say, share with us a little bit about the latest news about Nick. What's going on in your life? Share a little bit about you.
Absolutely. So first of all, Seppi, thank you so much for having me on. It's always a pleasure talking with you. I think you and I have talked about different concepts and ideas in the space so many times,
Mm.
and doing this kind of event is absolutely phenomenal. So thank you so much.
My pleasure.
So personally, there's a few things that I have in flight right now that I'm playing around with a little bit. So I'm not quite ready to announce that yet, but a few
Okay.
things that I'm working
So
with
that
right
means you'll just have to come back and share.
I guess, maybe in a bit. But
Okay.
there's a few organizations that I'm working with right now to
Okay.
help advise and guide and
Okay.
uh, really share some of the knowledge and some of the ideas back and forth,
Yeah.
because these things are not a one-way street,
Right.
right? The way that we learn about the innovations and the way that we come up with new and interesting ideas in the spaces by talking about them, by going and meeting people that we don't know, that we haven't seen before, that they have some ideas, you have some ideas, somewhere in the middle there might be a good idea. And a lot of that is what I've been doing a lot of lately, really, is sharing those ideas, discussing these things,
Hmm.
and really seeing if we can come up with the things that really matter.
Yeah. Isn't it ironic that AI and all these models are bringing to light how much more we as humans need to connect and talk, right? It
Absolutely.
it brings it even more to light that our industry is a human touch industry. No
Yeah.
matter how many tools we deploy or have perfected, it still requires us to have a two-way conversation, just like you said.
So what's funny about that, Seppi, is my tagline is always that AI creates a more human healthcare experience.
Hmm.
And so I
That's
think you
the
hit it
hope.
on the head there. That the way that we eliminate the things that we don't need to be doing and freeing ourselves to be able to have these conversations. You're not having to take notes in a meeting anymore, right? You're not having to constantly keep writing things and doing the things that are distracting you from what matters, from these human conversations, from these human interactions, whether it's like this or if it's a physician and a patient, whatever it might be. And just the ubiquitous presence of AI in our lives today, I feel like it's doing exactly that. It's making that a human experience powered by AI.
There you go. I like that tagline. I like it. Thank you, Nick, for joining us again and look forward to having you back. Best of luck. And to everyone else, thank you for listening. And I look forward to seeing you at our next episode of Digital Health News. Goodbye,
Thank
everybody.